Gonzalez. We are on our 102nd Table Talk. And again, Table Talk, I started over 5 years ago with the purpose of establishing being a thought leader in the food access space. So that's a lot of years and a lot of months that we're already doing this. Welcome again to the 102nd Table Talk. So let's start with prayer before we continue. Lord, we thank you for this day. Thank you for the sunshine. Thank you, Lord. Spring is coming. Looking forward to another season of your beauty. I pray, Lord, that you guide us as we talk about nutrition for this National Nutrition Month and other things that you're doing through the ministry of Faith, Hope, and Love. In Jesus' name, amen. All right, so I would like to start first with the updates that happened. Just last month, a lot of things had happened last month. And if you're following our Facebook, you will see that on our social media. By the way, we are creating a new website for Faith, Hope, and Love. That's fhlcommunity.org. So let me just put this here. That's fhlcommunity.org. And that's the website, the main website for Faith, Hope, and Love. And we're working on that to have a new facelift on that website. So, dip in Northeast. We have been doing this with the Northeast community through IU's initiative, which is called Diabetic Impact Project Indiana. And we're honored to partner with IU Health and also with the Avondale area and also the northeast quadrant of Indianapolis. So we want to thank you again for the opportunity. And just this month, in the last 4 weeks, we had four Latino applicants for missional food pantries and also one American for missional food pantries. What that means is that we do have an application process as far as the training, an intensive training for missional community or missional food pantry. We also added what we now call the missional community, which is in tandem with developing, not just developing food pantries on a missional level, but also engaging the entire community, which is, as many of us know, is a missional community. So we have four churches who applied from our Latino brothers and sisters and an American uh, church also to establish a missional food pantry. Another thing was I was honored and privileged to participate at the Food Justice and Faith held at Indiana State House and presented by Bread for the World. This is about again about food justice, and then also as a celebration of um, Black History Month last February or last month. Regular missional food pantry, and we are continuing to operate our missional food pantries all over um, central Indiana, and then of course the other division that we have, which is United Food Missions, which is focused on delivering charitable food um, to the homebound who are food insecure. And orientation for the academy for our instructors. So you may heard about the FHL Academy for leadership and transformation. And we're going to actually launch that next month, the month of April. So you will hear more about the academy in which we have partnered with another ministry, and now we're able to provide and present associate degrees to the students of this academy. But before that, before I continue on with different things that's happening in with faith, hope, and love, I'd like to talk about more about diet, food access, and health in the U.S. What that means is that if you are unaware, um, the this month is actually Nutrition Month, National Nutrition Month. So we'd like to recognize that. And again, we're going to talk a little bit about diet, food access, and health in the United States. By no means I'm a dietitian or a nutritionist, but this came from, if you will read the fine print, let me make that bigger. You will see that the credits of who presented this. So diet quality, it says here that number one risk factor for death in the U.S. is the diet quality, and that's again from the U.S. Burden of Disease collaborators. So that is a serious thing, for us to see that what we eat actually have direct impact in our health. And me myself, I was surprised to see this. Barb Morris was the one who sent me these slides, and she's the one who's leading our uh, new division, which is Food as Medicine, that will be launching later this month. And you will hear more about that in the next few days. Follow us on Facebook and also LinkedIn. Anyway, have you ever thought about that? Diet quality is the number one risk factor for death in the US. And, for me, I am getting up there in age. So I'm starting to change my diet. Um, you know, um, Even they said that red meat, okay, and this is the popular belief that red meat, if you have high cholesterol, is not good for you, for the fatty things if you eat that a lot. But also red meat contribute to aching joints. So if you're like me, I started to exercise again, as and going with my son 5 days a week to the gym. And I used to go to the gym, but stopped. So now I'm trying to get motivated again with that, because we want to live. If we are breathing, right? If we are breathing and we're alive, we want to be living with full life. Uh, as for our um, enjoyment of what God had given us, which is our life. And again, talking about God, He had given us this body, and we are privileged to have it, to experience the beauty of His creation. And you and I are creation by God as well. So we need to take care of this body. So again, number one risk factor for death in the US is the diet quality. Now, I'm eating prunes now, on a regular basis. Also, I try to eat green leafy vegetables, basically salad, as many times, probably 5 times, 5 times a week, as my daily diet, and then trying to cut back on carbohydrates and also sweets. I don't like sweets anyway, and fatty food. So the next thing here now is food insecurity. So now we are in this space, faith, hope, and love. as you have known, that we have been around for almost 20 years, which means that we're actually been around earlier than the other food access organization, well known here in Indiana or even outside Indiana. So we continue to work on this food access space. So it says here that increased probability of chronic illnesses being food insecure, and why? That's because let's look at the graph here. So it says here that being food insecure has diet quality, and we all know, and we are also, I think all the food pantries, or majority of the food pantries in the nation, are guilty of this, that we provide unhealthy food even to the people, to the detrimental of the people who are not supposed to eat some of the food that we give. And it's hard because it's costly, and it's hard to find, especially if you live here in Indiana. It's not impossible, but it's harder than when you live in tropical states such as Florida and maybe Atlanta, Louisiana, Mississippi, that they have more access to vegetables, fresh fruits and vegetables. Here in Indiana, or even in the northern states, we can also access that, but it's not as fresh and easily accessible as the southern states. But the reason I say that is that we have to be conscious as far as what we eat, the diet quality. So going back for food insecurity, and this also has something to do with food justice, which again, Faith, Hope, and Love have represented our organization during the Food Justice and Faith last month at the Indiana State uh, government building in downtown Indianapolis, and it was presented by Bread for the World, which I would like to thank them for the invitation. So the diet quality. So what we give at at food pantries is not very healthy. And again, now we can take a look at the next thing here, which is like this gear. The healthcare costs go up. So if you are in insurance, if you are in a hospital, if you are in the government, or even funder, now you will see that we're funding a lot of things about health. And that's why, the main thing, and our tag phrase with Faith, Hope, and Love, it's, you may say it's contradicting, but it's really not. We say that it's not so much about food, but about people. So let me explain that. If we educate people, then we will have more access, and also we will become cognizant and understand that what we eat directly affect the quality of our life. Just think about it. If for me, I think I'm healthy, above average healthy as compared to others that it's my age. I'm in my early 60s, believe it or not. So I still feel, the aches and pains, and looking for things, better food that I need to eat, and also my mental and emotional health. And also, food is connected also to our spiritual lives. So think about it. So healthcare costs. Let's go back to that. Healthcare costs go up. That's because our health, if you have diabetes, or if you have high blood pressure, high cholesterol, aching joints, or maybe constipated, right? And that's the fact of life. Or maybe you cannot process things quickly because your brain is not functioning well. then those are the outcomes, you know. But again, as long as we are breathing, why not live to its fullest, life to its fullest? And part of living life to its fullest is health, is good health as much as we can, because you and I were entrusted by God to keep this body, right? This is, you know, it's really sacred. You know, God had given us this sacred body because God is sacred, and God says that I have created you in my image. And if we really have to think about this, that God had created us to be in his image, what would you do, right? How would you react to that in treating your body? Not just loving your neighbors, loving God and loving neighbors, you know, those are great. But at the same time, if we don't love ourselves, if we don't give importance to what we eat, to the quality of what we put inside our brain, what we see, and the things, then that's going to affect overall, not just physically, but also emotionally and spiritually. Now, let's talk about healthcare costs. So, healthcare costs go up. You know, that's why, you know, insurance companies are looking, because it's not, you know, insurance is basically if something happened to you, right? So it could be, and again, all of us die, basically, right? Not basically, but the truth, all of us die. So the healthcare companies and also the insurance company would like to prevent more of the expenses before we die, that to save them. But at the same time, for us, you know, if we don't have insurance, what happened, right? What happened? We try to save money for maybe junk food or those things that directly contribute to the quality of our health. And then now we have to go to clinics. If we don't have insurance, that's even worse. Increase in probability of chronic illnesses. And I tell you what, it says here that we spend 52.8 billion in excess healthcare costs each year. That's a lot of money for healthcare costs. What if we can actually trim that down? Maybe trim that down by one fourth by eating healthy. And you know, eating healthy again has something to do with our emotion, how we process our world, how we think, how we react, and then also how we do life in the world. And if we are depressed, if we cannot function well, if we are, you know, cloudy in our mind, or depressed, right? Because we you know, the food, whatever we take, you know, has something that will affect us. So there are food that probably, you know, especially alcohol, can depress us. So that add to crime rate maybe, and also the quality of life, healthy living, quality of family relationship, and another relationship. Next thing is it reinforces and exacerbate inequities. So this one, I'm not going to spend a lot on that time, but you know, I'd like to see your comment about this before we continue on. All right. So next thing we'd like to talk about here is let me make this bigger. Oops. Um, let's see. So this one, there we go. So the next thing is that people with any kind of disability are three more times likely to develop diabetes. You know, I was at one point, I was borderline diabetic, and thank God that I was able to control it by what? Good eating habits and also exercise. I could do better, with good eating habits and exercise, but that helped. But I just think about a person who had diabetes. That once it get to the worst part of it, is that you have to take insulin, and then if it's not controlled, it could affect parts of your body, and you've seen worse than that. So again, this has something to do with the way we eat, the way we ingest, the way we put in our body. Next is a diabetic person with a disability is more likely than those without a disability to have clusters of risk factors for health disease and stroke. So that's another thing. It's not just like when you have a cut when you're diabetic, it's hard to heal. But at the same time, risk factors for heart disease and then stroke. And for us, we've seen some people that had stroke. Some of them are mild and they can continue on living almost the same as before. But there are some people that had a really bad stroke that paralyzed the entire body, and it's very sad to see that. So hopefully, with a better diet, that we might be able to avoid those things to happen. People with disabilities who have no aerobic activity are 50% more likely to have diseases such as diabetes, stroke, cancer, heart disease, etc. So this is again has something to do with food insecurity, and also wrong choice of food that could lead to stroke, cancer, and also heart disease. Then, 1 in 3 patients enter hospital malnourished. This is another new thing for me. I don't know if you thought about that uh, 1 in 3 patients, that's 1/3, right? So, just to put in perspective, 3 people who go to hospital um, are malnourished. So malnourished, which is not nourished, basically, individual is not just like uh, don't have a lot of food to eat, but probably don't put good nutrition in their body. That's what I think about being malnourished. So, but that's huge, So this has something to do with the chronic diseases. You may think, why is a malnourished individual 1 out of 3 people who go to hospital, and because they are malnourished? That's because again, the things that we talked about earlier, which is the quality of the food, what we ingest, what we put in our body, has direct impact, direct effect in our lives, in our health, in our body. Not just body, but also the way we think and the way we live. Healthcare costs are up to 3 times higher for malnourished patients. So again, this is a staggering, you know, statistics that healthcare costs are up 3 times for malnourished patients. So, what if we spend, all right, let's just talk about what if we spend more money on eating healthy? And again, we can say, hey, there are people who are on fixed income. They have to select between the medication and the food that they eat. And that's why at Faith, Hope, and Love, we try to understand, identify the deeper needs of an individual who come to any of our missional food pantries, because it's not just how much food we give them, but the quality of food that we give them. But also, we share with them that SNAP, right? The government can help. There's WIC, women, infant, that's provided by the government, and there are some other resources. And that's what we try to identify in the process of changing the culture of food access or food pantries, is that we try in our training, we try to identify the deeper needs. What are the possible causes of being food insecure, such as maybe undertrained, technical training for better jobs, underemployed or unemployment, of course, economics, and then also maybe some other factors that maybe addiction, right? So there are things that we need to take a look at to really help the individual beyond just giving bags of food. So going back again to healthcare costs are up 3 times. So if we say spend a little bit more money for nutritious food, and 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 say for example that our average monthly expense is $100 for healthcare cost. What if we say take $30 out of that $100 and use that $30 to buy healthier food? I wonder how our healthcare costs will go down. So again, that's just a rhetorical question for all of us to think about and to consider. Length of hospital stays for malnourished patients are up to 3 times longer than properly nourished patients. That's another thing that we have to really take a look at seriously. I don't know of anyone who would like to stay longer in hospital. I don't even want to go to hospital. Even visiting other people, it's just like sometimes it's depressing. And nothing against hospital. Hospital is great. We need hospitals, but the truth of it is that hospital exists because of uh, accidents or life threatening or sickness or diseases and all those things. But this one, we're talking about malnourished patients are up to 3 times longer than properly nourished patients. So why is that? Now, again, just think about it. For myself, um, my take on this is that if it's hard to recover, if our body it does not have the nourishment that it needs. It's just like the wound, right? If a person is diabetic, the wound is it doesn't heal as quickly as those who don't, and that's because of the components of the body, the chemical things that's happening in the body. And again, the food that we eat has direct impact in the composition, the chemical things that happen in our body, all the cells, healthy cells, unhealthy cells, and those things. So, but this is really something that we need to think about. So it's just staggering, and I'd like to have you start really thinking about this as we celebrate or as we observe National Nutrition Month. Now, in line with that, if you want this information, we can provide that to you in more details in the future. Just let us know, and we will send that more detailed. Especially once we launch the Food as Medicine. So let's talk about Food as Medicine division of Faith, Hope, and Love. Food as medicine, as we think, as what we have discussed, is that eating healthy can prevent us from having chronic diseases, and also eventually can prevent us from going to hospitals, and also prevent us from living, no energy, and the quality of life. It has something to do as well. So, Food as Medicine is a new division of Faith, Hope, and Love, and we will launch that officially later on this month as part of observing National Nutrition Month. And this food as medicine, we're going to partner not just with food pantries. It's going to be an alliance. So there will be food pantries, also other food production organization, and maybe even stores, grocery stores that we would like to partner with and educate them. So this is more about educating and learning more about how we can live healthier lives by understanding more about food as medicine for our body. So we're going to launch that division later this month. Talking about that, I was in Gary, Indiana, late last month, February, and I visited Progressive Missional Baptist Church. And the pastor there is Pastor Whitaker, and he had created like a sustainable little community there around his church. He has like chicken, and if you want to see that, it's still posted on our Facebook. You can just go to the later posting in February. So he has chicken, he has ducks, he has goats, he has trees, fruit bearing trees, and vegetable garden that they're cultivating now, and they also have I forgot what the term is. It's just like an aquaponic, so that they can grow vegetables even in the cold season. So that's and they're doing food as medicine themselves as well. So that's we were there, and I learned a lot, and so encouraged that a lot of organizations are doing this and really caring for their community. So we have launched the Salt View, and this is Salt View. You have heard about it. That Salt View is our signature outreach, which is a not just a food pantry management software, but it's actually for food access. All right, so it's bigger than food pantry. It's food access management software, and we know that data is like hidden treasure. And I think I coined that. I never heard that before, but hidden treasure. So think about it, that we were talking about healthcare, we were talking about nutrition, and we're talking about that it's not just when people come to your food pantry, they may be hungry physically, but also hungry spiritually or emotionally. So there are many factors and causes that contribute to a person who is food insecure. It could be, we talked about it earlier, it could be unemployment or underemployment, or because they cannot find a good job because they need more technical training, maybe addiction of some kind, or healthy living. So once we identify those, then we will be able to uh, connect them to different resources, community resources. And again, here in United States, the number one country in the world, has a lot of resources that's not being utilized or underutilized. So once we identify the data, such as and we have been doing this from the very beginning, back in over 15 years ago, when we start training food pantries to establish a missional food pantry. We teach them about the importance of information, the importance of data, which means that we try to identify, what are the hindrances. We ask them, and that's part of the training, to understand the needs of individuals. So once we find out that, we try to find out their age bracket, and then of course the race and ethnicity, the age. So say for example, you have um, an individual uh, or that's need of food and came over, and we later on found out that he needs help in say addiction. So now we can help that individual to to connect to other resources so that he can deal with it, because it's hindering him from living a more progressive life. So now we have created this software that will provide vital data. So let's look at the different things here. So it's empowering food pantries with data-driven impact. SolveView software provides a more equitable solution for food pantries and food access, serving their recipients in smaller and underserved food pantries. And that's something that our Faith, Hope, and Love ministry focuses on, helping what I call underserved organizations or underserved food pantries. Not just the underserved individuals, but also there are underserved food pantries because they are small. And so I'm just saying that not all small food pantries are the same, but because they are small to medium sized organizations, they don't have a lot of resources. But for us, these smaller to medium sized food pantries are embedded in the community, which means that most of them are church based and they already have relationship with the local community. So what if we empower the smaller to medium sized food pantries so that they can serve the areas of the city that are, maybe less affluent? And what is SolveView? So again, we talk about that it is a proprietary solution to manage different kinds of data that is being gathered, and that's why I call it hidden treasure. If you operate a food pantry, you may say, well, I don't really get any grants. I don't get any funding, but we have to take a look at the reporting system. Do we have the data? Do we have the reporting? Do we have the analysis that we can provide, say, a funder or maybe the government or maybe other organizations? Because again, they want to help maybe, but they are not educated how to help you or what you're really doing. What's the impact of your food pantry? So this data, once you provide that, then you can probably apply for grants and also for financial stability and sustainability of your food pantry. And we all know that a lot of food pantries, I don't know the percentage, but they start for a few months or a year, and then after that, they're gone. That's because they are not trained or they're not resourcing around the community. And again, with the community, there are wells of resources around our community. We don't live in a desert land that there's really no food or there's the economy is so bad. Granted that there are less economic progressive places in our neighborhood, but we can resource, and that's part of keeping data and providing those data, providing solution. Once we analyze the data, we can actually see what the main problems are or things that contribute to uh, being food insecure. But look at these statistics. Smaller food pantries serve 40% of all food nationwide, of all the food nationwide. So that's good, and that's why we try to help the smaller to medium sized food pantries. Nothing against with the large food pantries. I think that's great. They distribute a lot of food, but at the same time, there's something about smaller to medium sized food pantries that are more in general, more relational because, again, they have already created relationship within their own community by the churches who have food pantries. So now they trust. There's more trust, and then they can understand more in deeper ways how to help the food insecure or the people who come to their food pantry. Smaller food pantries lack the same access to funding as large organizations. We talk about that already. That unfortunately, smaller food pantries tend to do a lot more because there's less resources, there's less volunteers, and then because of that, then they don't have the resource to put together maybe report analysis and report to the funder. So larger organizations receive more and more, and we need to empower the small to medium sized food pantries. Smaller food pantries don't often don't have the necessary staff, and we talk about that already. Internal resources for creating accurate data, and that's why SaltView software is needed. It's the hidden treasure that's hidden in our filing cabinets. And once we pull out those information, and once we put them in right reporting that can be understandable or understood by the funder, by the government, by businesses, by other churches, by other pantries. Now we can substantiate why we need more funding, why we need funding for healthier food, as we talked about earlier for this month of National Nutrition Month. So this will help them, a lot. So this is the solution that we say, also we address the cycles of poverty currently are placing huge burdens on today's food delivery system. Uh, there's food insecurity is very complex. And if we only deal with the amount of food that we give, then I think we're going the wrong direction because we're serving people, and sometimes if our volunteers are uninformed and they don't have the information that, say, for example, if we can identify those data that contribute to uh, the individuals being food insecure, then we can help them better. Maybe we can shorten the line. The ultimate success, measurement of success for Faith, Hope, and Love Missional Food Pantry is to close the food pantries. That means that we have actually done our job, that we don't create or enable people, and I'd like for you to understand this more, that sometimes being kind is being abused by the people that we serve, which means that we enable them. We say, okay, well, if you run out of food, and again, in generality, you can go to another food pantry on Monday, another food pantry on Tuesday and Friday, and so on and so forth, which is okay. Granted that there are people who really need that they cannot do anything. But most of the people that go to the food pantries, if we look at the data, if we look at the analysis of the people that come to the food pantry, most of them would be able to change the direction. For some people, it became the strategy for living, is go to food pantry, and that is sad in the land of opportunity. I don't know if you were born here in the United States, maybe sometimes you miss that. But if you were born, just like for me, in a third world country, I was born in the Philippines and left in my 20s and came over to United States, and I see a lot of opportunities, a lot of ways that we can help one another, not just ourselves, but help one another. So again, but before we can do that, we need data, we need information, we need to understand where people are coming from and where they want to go, and understand that there are plenty of resources all around us. And with those resources we can connect people with the solutions that they are looking for. So being a missional food pantry, we're not saying that we'll provide you food month after month after month, although we can. But the idea is not for you to come back month after month if you are able to change the trajectory of your future. So some of the primary benefits, I'm not going to go through all of this, and we'll finish up in the next few minutes here. Providing necessary and timely data for city planning. So this is like for the city. Say for example in Indianapolis, the Indianapolis government can take a look at really what's happening. Say for example, you go to you pull data from 46208 zip code, and then out of 10 food pantries who provided this SaltView software reports to say the health department, then they can really take a look. Oh, okay, so there are 30% who are white Americans. There are 40% or 50% African American, and there are 20% who are Latinos. So now, if from the bird's eye view, you can really say, okay, well, what does this data tell us? What does it mean that uh, uh, there are higher percentage in this kind of race than the less one? What can we do? And say again, for example, you can look at how many are over 65 years old in certain geographic area, and when you look at that, how many are in over 65 years old, then that's maybe people are probably retired, right? That's the retirement age. And now for the government, we can say, okay, well, are we providing enough, or the funders, are we providing enough resources, additional resources for the senior citizen? Or maybe why is it that in comparable from one zip code to another, one zip code has uh, more, say, unhealthy, than the other zip code? Or why is there more crime than the other one? And now we're talking about, we're talking about nutrition, right? We're talking about food access. But I tell you what, desperate people do desperate things. And if, I am a father, say, for example, and I see my baby crying, and I don't have enough food to give to the baby, and I don't have much resources, what would I do? I might do some desperate thing because I don't have much education. And again, all of this data feeds into something that will help. It's just part of a larger, food insecurity complexity. So that's why data is very, very important. And the last thing here is that SaltView management software automates the entire process, reducing human errors and improving data and results for stakeholders. Let's look at a couple more bullet points here. Learning key insights to know how to target local resources and grants. Again, if you're a small to medium-sized food pantry, even the larger, data is very important for proving, giving evidence why you need more funding, reduce the number of internal resources needed to manually generate reports. And many of us just like, okay, let's gather all the paperwork, and then let's handwrite them or use an Excel, and these are time consuming. But if we have a software like this, that once you enter the data, you can query, you can ask for like the percentage of the races of the people that you serve, and also the percentage of the elderly, or the percentage of people who are unemployed, or male or female. Those things are keys to understanding who we are serving, and if our system is really working for the benefit of everyone. access to data for special dietary and cultural needs to provide diverse selection of food. We talk about food justice. I tell you what, we go to a food pantry, and our organization is guilty of this too, because we just have less resources. But the start of change is being aware of what we do. All right. So we have a long way to go, but we're moving forward to progress. So some it might be, food justice is not just you know for the type of food. Actually, that's what food justice. If you have somebody from, say, Latino population, they may tend to uh, know and to eat more of rice and beans. If a person is, say, from Asia, maybe more rice and different kinds of things. And if you're an American, it's different. Different kinds of food. So again, we give food that it's not fair. Sometimes for people, they receive the food that they don't really need. And again, not that our food pantries are already are perfect. We have a long way to go. But again, if we become more aware of what we're doing now, I think that's the first step for us to move forward to the progressive way of food access. I tell you what, there's always better way of doing things. But data is very important in order for us to change, because you cannot change if you don't know really your standard and what's happening here, so that you can move forward to where you want to go. All right, we're almost done here. So, SaltView, this is what one of our missional food pantry is already using the SaltView software. It's transforming our record keeping and reducing errors that are currently costing our food pantry valuable time and resources. So again, data is hidden treasure, if we find those hidden treasure, then we need good record keeping, such as the SaltView software. And it just talk about the timeline here. And that's um, it's all about analytics. It's just like too technical term, but it's basically analysis of what you're already doing. All right, what you have done, is it really effective, and is there way for growth, is there room for growth, and are we contributing to the problem because we're too kind, or are we actually empowering people? So there are some report here. Again, just want to show you some of the things that we do. A monthly report that we're doing that will be helping uh, food pantries in the future. And we talk about average age ranges by household. So now we can take a look at the highest percentage of households served. Say, for example, it's 26 to 65 years old. So what does that mean for us, or for your community? Education level. We know that economic has something to do with being food insecure. And basically, in generality, people who have more education have higher uh, percentage of higher pay. Percentage of household members served. So this one, we can see 40% are one member household in this particular report. And then 27% are three members. And then on the next one here, African American percent of household, and then Latinos, Hispanics are 75%, Caucasian are 20. So now this is based on zip code or neighborhood. So now if you say, for example, you see this, maybe, and if you are a church, you can maybe offer English as second language to help them, because language and communication is essential for us to progress economically, and not just economically in life. We need, this is a country that speaks, that the main language is English. right? So, if you want to progress in an English speaking country, then maybe consider learning more about English. So monthly food delivery by parcel, by ethnicity. This is, for we have United Food Missions, which is a charitable food distribution or delivery that we do for a homebound individual. Genders, that's also very important. Female dominate the percentage of that, and then household that are not first time visitors, and then you can see currently being served. So these are like the zip code for this particular food pantry. These are the zip code that come to their food pantry. But again, if you're analyzing it, you have Hamilton County, Marin County, and Boone County. So this is probably more on the northwest side. This pantry is probably more on the northwest side of city of Indianapolis. Then, but that's about what SaltView software is. So we just didn't have enough time to give you more information. But I'd like to thank our supporters, our donors in our continued quest to change the landscape of food access for our community, not just here in Indiana, but for the entire United States. I'd like to thank our volunteers, again, supporters, staff, for believing in the mission of Faith, Hope, and Love. Want to thank our one of our newest partners, Fathers and Families Center. A good friend of mine run that is the leader of that organization, Larry Smith, and we launched them as a what we call neighborhood hub, which means it's a site, pickup site for our DoorDash partners. We deliver the food to the homebound who are food insecure. And coming up very soon is Right to End Hunger. This is one of our fundraiser. So that's in May. And if you know or if you like to ride bikes, motorcycle, not bicycle, motorcycle, that's later on in the month of May. And lastly, our Beyond This Hunger program, which is for mental wellness, is taking off pretty quickly. We have a graduate from one of the leaders in the um, northeast part of Indianapolis and part of our DIPIN program, Diabetes Impact Program, Indiana, in the Northeast. She graduated and received a certificate that she finished the Beyond This Hunger program. And then Casa de Restauracion, that's House of Restoration. It's a Latino um, church in the southwest side of Indianapolis, and they are currently doing it. There are 50 participants just in one church, 50 participants who are going through this workshop. So if you want to, again, you want to find out more the different things that Faith, Hope, and Love does, you can email me personally at Merlin at fhlinternational.org. That's MERLIN at fhlinternational.org. Or you can go to our website to find out more about what we do. And I'd like to thank you for staying up with me and talk more about it. Again, it's about the relationship. It's about partnership. It's about collaboration, networking, and working with each other, because not one organization can do this all. It's a very, very complex issue, food insecurity, but together we can make bigger impact and sustainability for our neighborhoods. God bless you. And let me just end in prayer. Lord, we give you thanks today. Thank you for this time that we were able to spend time together and learn more about the importance of food in our lives, Lord Jesus, and also that we you have given us trust, and you have given us charge to um, affect this food insecurity, not just in this state, but in the nation. So I ask that you provide us wisdom, resources that we need, and funding for the expansion of your kingdom. In Jesus' name, amen. God bless you all, and we will see you again next month.